Hello everyone and welcome to my channel Body Mind Healing. My name is Maria Sanchez. I am a holistic health consultant, a family nurse practitioner, a psychiatric mental health nurse practitioner, and a doctor in nursing practice. The case for today is burnout versus depression. In medical practice today, it is common to encounter patients who arrive with symptoms of extreme fatigue, lack of motivation, and persistent sadness. One of the greatest diagnostic challenges is differentiating between burnout syndrome and depression, since both share similar manifestations but have different origins, courses, and treatments. Let's look at burnout syndrome. Burnout is a phenomenon closely linked to the work environment. It is defined as a response to chronic job-related stress that has not been managed adequately. The three main dimensions of burnout are emotional exhaustion, depersonalization, and reduced personal accomplishment. Emotional exhaustion, the loss of energy, constant fatigue, and the feeling of having nothing more to give. Depersonalization, a cynical, cold, or distant attitude toward colleagues or patients as a defensive response to stress. Reduced personal accomplishment, the sense of inefficiency, demotivation, and lack of meaningful achievement. Scientific studies have shown that burnout occurs most frequently among service or helping professionals such as doctors, nurses, teachers, and psychotherapists, where the emotional load and social responsibility are high. Research has also shown the lack of institutional support, work overload, and discrepancies between personal values and job demands as being the main triggers. In terms of treatment, it is important to implement a multidisciplinary model. Psychotherapy, stress reduction programs such as mindfulness-based stress reduction, and workplace adjustments simultaneously. In cases with associated depressive symptoms, pharmacological interventions may also be necessary. Now let's look at depression. Depression, on the other hand, is a mood disorder with a multifactorial basis, biological, psychological, and social, that is not necessarily tied to the work environment. Depression is characterized by persistent sadness, loss of interest, sleep and appetite disturbances, feelings of guilt, and recurrent thoughts of worthlessness or even death. Major depression can appear in varying intensities, from mild episodes to complex presentations with suicidal risk. Risk factors include family history, neurochemical imbalances, childhood trauma, chronic illnesses, and substance use. Scientific evidence supports several effective treatments for depression. Cognitive behavioral therapy and interpersonal therapy have shown consistent efficacy. Antidepressants such as SSRIs and SNRIs are recommended for moderate to severe cases. Lifestyle interventions, including exercise, restorative sleep, and balanced nutrition, also contribute significantly to recovery. And now let's look at key differences between burnout and depression. Although these two conditions share symptoms such as fatigue, hopelessness, and loss of motivation, there are essential points of differentiation. For example, origin. Burnout arises mainly in the workplace. Depression may occur independently of work with broader causes such as generic, biological, or emotional. Symptoms. Burnout is marked by emotional and physical exhaustion tied to work. Depression's central symptom is a persistently low mood that affects all areas of life. Reversibility. Burnout often improves with rest, vacations, reduced workload, or environmental changes. Depression requires clinical treatment and might persist even without workplace stressors. Self-image. In burnout, self-image remains relatively intact, though the person feels ineffective at work. In depression, self-image often deteriorates globally. For example, I'm useless, I have no value as a person. An important point is that untreated burnout can evolve into depression. Studies have shown that up to 30 to 40% of those with burnout end up developing a major depressive episode if they do not receive intervention. This reinforces the importance of timely treatment. In fact, the recommendation is that every patient with burnout also be evaluated for depression given the high comorbidity. Ignoring the emotional and existential dimension of burnout increases the risk of it turning it into a more severe depressive disorder. A vital aspect to keep in mind is that medications only help to calm the symptoms, but they do not heal these processes. The only way to truly heal them is by paying attention to ourselves, to the underlying issues, and working through them. In other words, beyond clinical diagnosis, both burnout and depression invite deep reflection. In burnout, the person often loses connection with the purpose and the joy of the vocation. In depression, the pain is rooted in unresolved emotional wounds, often originating in childhood. From a spiritual perspective, both conditions can be seen as calls to reconnect with our inner worth, with our emotions, with our boundaries, with our beliefs, with our capacity to love, and with the transcendent meaning of our existence. Practices such as self-care, meditation, connection with nature, prayer, or personal spirituality integrated into medical care can guide us toward healing. In conclusion, burnout and depression are two phases of human suffering that, while similar, should not be confused. One arises in the workplace. The other extends across all of life. One might ease with changes in the environment. The other requires a comprehensive clinical approach. Yet, both share something fundamental. They are warning signs reminding us that body, mind, and spirit need attention. The best strategy is a combined approach that includes medical, psychological, social, and spiritual support. Recognizing, differentiating, and adequately treating these conditions not only prevents complications, but also opens the door to healing, to regaining balance and wholeness in our daily lives. Remember, healing is returning to ourselves again and again. Until next time.